Have a look inside yourself. What are anxiety disorders? Hello, enlightenment enthusiast. Welcome back to Have a Look Inside. Join the ride, fellow hitchhiker. Flash that thumb with a like and subscribe to never miss a stop. Anxiety and panic attacks. This video explains anxiety and panic attacks, including possible causes and how you can access treatment and support. Includes tips for helping yourself and guidance for friends and family. Anxiety can be experienced in lots of different ways. If your experiences meet certain criteria, your doctor might diagnose you with a specific anxiety disorder. Some commonly diagnosed anxiety disorders are generalized anxiety disorder, GAD. This means having regular or uncontrollable worries about many different things in your everyday life. Because there are lots of possible symptoms of anxiety, this can be quite a broad diagnosis, meaning that the problems you experience with GAD might be quite different from another person's experiences. Social anxiety disorder. This diagnosis means you experience extreme fear or anxiety triggered by social situations, such as parties, workplaces, or everyday situations where you have to talk to another person. It is also known as social phobia. Panic disorder. This means having regular or frequent panic attacks without a clear cause or trigger. Experiencing panic disorder can mean that you feel constantly afraid of having another panic attack, to the point that this fear itself can trigger your panic attacks. Phobias. A phobia is an extreme fear or anxiety triggered by a particular situation, such as going outside, or a particular object, such as spiders. Post-traumatic stress disorder, PTSD. This is a diagnosis you may be given if you develop anxiety problems after going through something you found traumatic. PTSD can involve experiencing flashbacks or nightmares, which can feel like you're reliving all the fear and anxiety you experienced at the time of the traumatic events. Obsessive-compulsive disorder, OCD. You may be given this diagnosis if your anxiety problems involve having repetitive thoughts, behaviors, or urges. Health anxiety. This means you experience obsessions and compulsions relating to illness, including researching symptoms or checking to see if you have them. It is all related to OCD. Body dysmorphic disorder, BDD. This means you experience obsessions and compulsions relating to your physical appearance. Perinatal anxiety or perinatal OCD. Some people develop anxiety problems during pregnancy or in the first year after giving birth. You might not have or want a diagnosis of a particular anxiety disorder, but it might still be useful to learn more about these different diagnoses to help you think about your own experiences of anxiety and consider options for support. Living with GAD and panic attacks after losing a parent. I really believe that talking is one of the best therapies you can have. It's like a swarm of bees just buzzing, not stopping, making it impossible to focus and seemingly impossible to slow down and take a breath. Anxiety and other mental health problems. It's very common to experience anxiety alongside other mental health problems, such as depression or suicidal feelings. If you have symptoms of both anxiety and depression, but don't fit one more clearly than the other, you might be given a diagnosis of mixed anxiety and depressive disorder. I thought anxiety would be my biggest challenge. I was wrong. I felt fine. I always feel fine when I'm awake. I really think that's a part of the problem. I have generalized anxiety disorder and depression, which seem to come in cycles. It is the unexpected attacks that I find the hardest. Well, that's all, folks. Thank you for watching Have a Look Inside. So what do you think? Please leave your comments below. Until next time, happy living. Visit megdigital.com.